Hi guys, welcome back to Code Master Coach, your medical coding tutor. Guys, today I wanted to come to you with where are the jobs in medical coding? I'm often asked, Coach, I can't find a job. Where are the jobs in medical coding? Where should I be looking? And guys, I always say wherever healthcare is rendered and insurance, I try to say follow the money, and insurance is involved, there needs to be medical codes. And so I can remember years ago, it had to have been at least 15 years ago, when I went to a dentist. The dentist told me, he said, there's got to be a way for dentists to get in on the medical side of healthcare. That was 15, 20 years ago. Dentists should be able to get in on the healthcare side for reimbursement purposes. Because remember, dentistry, medical coding is a HCPCS code. So it's usually generated based on, revenue is generated based on a supply code, a filling, an x-ray, a cleaning, that's it. And so I can remember telling that physician 15, 20 years ago, if you see a medical condition, although it's in the teeth or in the dental area, I don't see why you can't submit a claim to the medical side of healthcare to get reimbursed. And guys, we're seeing more and more of that today. So now dentist offices are looking for medical coders to code medical claims for dental services. Okay? Think about another area. Veterinarian. Now, I don't see it yet, but I'm predicting, I'm telling you, if we're going to be able to carry our pets on our insurance, or even purchase pet insurance, where do you think that's going to go? There are going to need to be codes for veterinarian. We're going to have to submit claims for veterinary services. I see that growing. What areas do you think? I mean, because today, right now, insurance companies, who would have ever thought insurance companies would hire coders? But today, if you work in a hospital or a physician's office and you submit a claim to Blue Cross Blue Shield or other commercial insurance, even Medicare, Medicaid, think about the rack. When you submitted those claims with your codes, they had coders there auditing your claim to make sure it was appropriate before they reimburse you. So now where coders were just on the physician side or the facility side of medical coding, now we're in the insurance company. We're checking the coders that code in the facilities codes. Hospitals, I already mentioned that. Nursing facilities. And guys, when I think of other nursing type facilities, I'm talking home health, rehab. Where are the other facilities, even outpatient, where services are rendered outside of the hospital? Claims are being submitted. Somebody's doing the coding because the claims are submitted with medical codes. ICD-10-CM for the diagnosis, CPT for the procedure, or ICD-10-PCS for the hospital's reimbursement, HCPCS codes for the supplies. Somebody's generating these codes. Medical coders. State government agencies and federal government agencies. Medicare, Medicaid has their coders as well. You remember that rack audit that scared all of us when they were going back 3 years checking all Medicare, Medicaid claims and taking back their monies? They had coders. Career colleges, they need you to teach it, so you got to know it. Information technology services, because you remember IT is getting into everything these days. Everything is going computer. So with coding, we need to be on the bandwagon getting in there as well. Medical billing services. A lot of coders are learning to do the billing side, and we're doing the billing and the coding for different companies or different facilities, physician offices, hospitals, etc. Look at law firms. Who would have ever thought a law firm? But law firms are also hiring coders to check claims that are submitted to make sure they were appropriately filed. medical laboratories to make sure the correct laboratory code is assigned. And even these outside labs that need to generate their claim for their services, they need medical coders. And I've already mentioned dental offices, rehabilitation services, collection agencies. I always tell my coders, a good avenue in the beginning is just tell a physician, if you're trying to create your own job, tell a physician, you know what, doc? Let me go back and audit your claims and give me 10% of whatever mistakes I find. But I will only refile a claim if I can make more money for you. Okay? Collection agencies. And then even clearinghouses. Who do you think are the ones in the center? We submit our claims to Blue Cross Blue Shield, but before it goes to Blue Cross Blue Shield, it goes to the clearinghouse to check the mistakes. And then the clearinghouse notifies us if there's mistakes on the claim so we can correct it before it goes to the third-party payer. Well, they need someone that knows the medical coding with the clearinghouses. So there's a bunch of avenues for medical coders. So again, what can medical coders do? There's a whole lot to medical coding. Join me, guys. If you haven't yet subscribed to my channel, please do so. And let's keep the discussion going. I'll see you in the next video.